Hello everyone, welcome to today's conversation. Diabetes is something almost every family is touched by today. Yet there is so much confusion around the food, lifestyle, stress, and sleep, and especially medicines. And especially this month, fasting during Ramadan is another big thing. So, to bring clarity, today I'm joined by Dr. Mohammed Aleemuddin, consultant in preventive diabetes, medalist, a gold medalist in MD. He added multiple diabetes research papers and patents to his name. He is also the founder and director of Hayat Elite Hospitals, Zahirabad. Today, together, we hope to blend medical science with the lifestyle wisdom. Thank you, doctor, for joining us. And let's begin with the big picture. So, to start with, doctor, diabetes is rising everywhere. And what is the real reason behind this epidemic today?
So thank you, Reema, for this kind opportunity for providing me. And I believe myself as a student of diabetes, where I'm learning every day with you and all the healthcare professionals around us. So to understand this, let us now first begin to say that this is not an epidemic, this is a pandemic. Now, diabetes is there in every nook and corner of the world. Unfortunately, India has become the number one country with the people of diabetes. So, this population did not come recently. It has been going slowly over the period of the last beginning of the century. So it has now exploded because of three main reasons. First, our lack of sleep. Second, ultra processed food. And third, and most importantly, stress all around. So I believe that this is not a epidemic of diabetes, but this is a pandemic of lifestyle.
Yes, true, true. As you said, so India is becoming the number one capital for diabetes, and there are we can found if each family has a diabetic patient in their family. So, when it comes to diabetes, what are the earliest warning signs people ignore before the diagnosis?
So, diabetes, as we all know through our research, we have found out that diabetes is not one point of disease. It is a continuum of a disorder. Now, there is something called pre-diabetes before diabetes. And before somebody is diagnosed with diabetes, already his beta cells, which are responsible for the production of insulin, have depleted as much as 50%. So, to find out the early signs, there can be very easy to find any blackening around the neck, acanthosis nigricans, which we see, and then blackening of the underarms. And most importantly, if somebody is overweight or obese, then definitely he is at the risk of diabetes. The common symptoms of frequent urination, frequent hunger, polydipsia, polyuria, these we find at the very late onset of diabetes where already damage is done. So I urge all of our listeners to get themselves checked for their random blood glucose sugars at least once in a year and see for all these pre-diabetes signs
True, true, sir.
and
So,
watch for their weight most importantly.
yeah. So, when it comes to blood parameters, is there any blood markers that we can get checked to know whether we are pre-diabetic? So, people will be taking up their routine, right, every year. So, is there any blood parameters like the beta cells which we can get checked in the blood parameters itself to undergo
The
the?
easiest, the easiest one is to get HbA1c done.
Okay.
HbA1c is actually a 3 month sugar level in your blood.
Mm.
So, unfortunately, in India, because anemia and other disorders, sometimes this HbA1c is also not much reliable. But
Mm.
at least 70 to 80% of the times, if your HbA1c is less than 5.5, then you can safely say that you are not in pre-diabetes and your sugars are well under control.
Oh, fine, fine, doctor. Then is that if the person is anemic, then their HbA1c values could have a difference.
Yes. So this HbA1c is nothing but the level of glucose which is bound in your hemoglobin.
Hmm.
Once your hemoglobin is low, as in the case of anemia, then it will give you false readings.
Okay, that's interesting to know because mostly people will be considering HbA1c is just because of the blood glucose and
Yeah, it is the gold standard many people think.
yeah, but if it is related to HB means then it is mandatory for all the diabetic people to get know about their HB value also then. Great, great,
Yes.
sir. So, when it comes to diabetes, there is a myth that it is not reversible. So, as a physician, I want to know, like, is truly diabetes reversible or is it only controllable? What does the science say regarding it?
So let us first understand by this word reversible first, because we have to define the terms and then speak about them. So if you say reversible in the terms of organ damage, then surely it doesn't happen, because diabetes, as we all know, is a metabolic disorder in which there is something called advanced glycate end products which come and damage the blood vessels around the organs. Now, because of long duration of diabetes, if your end organs like your heart, kidney, liver, and eyes are already damaged, then surely you cannot reverse them. But if there is type 2 diabetes in the early stages, then if your sugars are under control and with the help of lots of lifestyle medication and nutritionists like you and little bit medications, when sugars are brought under control, then we can say it is reversible. But for this also, I would like to say that the correct word is remission and not reversibility,
True.
as defined by American Diabetes Association and also RSSTI, which I am a part of.
Great, great, sir. So the people has to follow the medication and also maintain a set of lifestyle changes for throughout their life, not even a certain period. I hope they have to maintain this throughout their life in order to be in that remission stage itself, right? So if they
Yes.
fail to manage their lifestyle, is there any chances to get their diabetes back once again?
Of course, of course. Now, to our, I have to just point out that when we say bad lifestyle, let us understand what is the natural lifestyle first. So, a few decades ago, let's say in the beginning of this century, all of us were in agriculture. Whenever we wanted some food, we would either go hunt for it or we would go to farming. We would go in the profession where majority of laborers hard work used to be there, which correlated to increased physical activity. So this was natural lifestyle for us. But due to this rapid urbanization, we ourselves have made it as bad lifestyle by decreasing our physical activity and increasing the number of calories.
True, true. So there is a lots and lots of fast food also happening, which make the people easy to grab many foods easily at a short period of time. True, sir. So since food is the biggest confusion area, so I think we can take a shift towards the food part of for diabetes. So as a diabetologist, what is the biggest diet myth that you have ever heard from a patient?
So I always come along to all of my patients to give me a diabetes diet plan,
Hmm.
which I tell them that there is nothing as such as a diabetes diet which exists, which I know of. Let us understand that there are so many myths around diabetes, and with the advent of this social media, people have turned diabetes like a rocket science or a complex things. It is very easy to understand. Something which is spiking your sugars, you just have to avoid it. If somebody who is there from Africa and if he is taking a different diet, I cannot ask him to take two rotis in the morning, one idli in the breakfast, and one dosa in the next day. So we have to tailor the diabetes diet according to their needs. I always say you can take whatever you want. There is no problem at all. But just remember that anything of too much is too bad. You have to take in moderation. And if somebody asks me a simple diet plan, I just tell them to avoid all whites like white sugar, white maida, white salt, oil, and avoid little bit of white rice also. Now, please remember, I am using the word avoid. I am not saying completely block them and take off more colorful things like colorful vegetables and colorful fruits.
True, true.
And
So
I think that you are a better person to talk about this than me about
yes,
the diet.
yes. So, but since you are working in person with the patients, I would like to know whether because there is a myth that rice is the really the villain in Indian diabetes. So whenever patients started saying that I have started stopping eating the rice. So as you said, people have to actually limit the quantity of the rice, and they have to balance it with correct proportion of dal and vegetables with some protein source and fiber source, so that the rice really don't spike. So how easily the patients would get convinced of this fact that rice is not a villain, sir?
So you have to understand that rice is a staple diet of South India, irrespective of whatever any global expert says or anybody says. Rice is there here to stay. Now, the problem with the rice is only three P's. First, polished rice. Second, as you take the portion of rice. And most importantly, the protein intake with the rice. If we manage all of these, then you can take it. And now people have come with brown rice, other source of rice, which are very costly. I do not understand the need for this. I always say, always be natural and buy natural.
That's true, sir. Because people are going for like ancient variety of rices, which is also quite good for the fiber part. But still, if they are new to the ancient rice varieties, it is not palatable for them to have it. So rather than swapping as a whole to ancient varieties, like red rice or the brown rice, it is always better to start with like weekly ones of the other varieties, and the rest of the days I hope they can have their regular white rice with a limited quantity where the portion size matters, I think, right, sir?
Exactly.
Yes, yes. So another big fear which diabetic people hold is like about fruits. Are fruits safe for the diabetics, and what is the quantity and when can they have it, sir?
So I always tell them that people have made their own statements about fruits, and there are so many myths which are floating around the internet. Now, when we say fruit, first let us understand that when I say fruit, many people think it like taking it anyway, like we even consider taking fruit juice also.
Mm,
Now we have to understand you can eat only one or two apples at the maximum, or one or two oranges at the maximum. But you can drink two or three glasses of orange juice also. But for each glass of orange juice, you may need three or four oranges. So, in effect, you can drink even 7 to 8 glasses, 7 to 8 oranges at one go. Once you remove the fiber out of the fruit, then you are only taking the fructose or glucose or whatever chemical name you want to give it. This is very important that you can take any kind of fruit, but with a fruit as a whole and not fruit juice. And most importantly, limit the portion. The
true.
sad part of Indian reality is we prefer having snacks over fruits in all our diets, in all meals. Hardly you will see a fruit here on our dining table. And if it is there on the dining table, it will be there only on the dining table and not in the plate or in the stomach.
True, true, sir. Also,
So if we so
yes, sir.
if we stop telling people to limit the fruits, I'm sure they will not even take whatever fruits they are taking.
Yeah, yeah. So the best way is to maintain a proper portion size when it comes to fruit. Also, maybe one fruit a day they can have it on a regular basis. And if
Yes.
their HbA1c is under control, I hope they can have it on a regular basis. They should have it on a regular basis.
Of course, the
And
fruits contain a lot of antioxidants, fiber, which is very much important for our health.
yeah, true. Because it has much of vitamins and minerals, which is important for the basic functioning of the body. And I hope they can add some protein portion like roasted chana dal or nuts and seeds to the fruit, so that the glucose spike is not happening at the as of comparatively while having the fruit itself. So while we
Yes.
are counseling the clients, we will be suggesting to pair it with some nuts and seeds like almonds or walnuts, or at least a handful of roasted peanuts along with the fruit, so that the spike doesn't happen. And
Sure.
yeah, yeah, great, great, sir. Thank you over that. So then, since Indians are sweet tooth people, we love to have sweets. But when the moment we are said that the person is diagnosed with diabetes, they will be asking for the other option for the sweetness, like whether they can have like artificial sweeteners or jaggery or palm sugar. So when clients come, so how do you address them, sir? Address the patients.
So to begin with, sugar in white color, brown color, in a packet. you call it artificial sweetener, whatever you call. Sugar is always a sugar only. It is always best to avoid them. But according to FDA rules, the artificial sweeteners are permitted, and I believe in my practice that stevia is better form of sugar rather than other things.
Oh, okay, sir. But there is a new form of sugar called the monk fruit sweetener, which is like also a natural form of sugar. Can you just throw some light over that, sir?
Yeah, this monk fruit sugar is in trend these days, and it will go down, and some other new product will come after some days. So this is happening with diabetes since the beginning of the century.
Mm,
So as I told you earlier, it is always to best be to be natural.
great, great, sir. So maybe they can have a small piece of dates with nuts in case if they are
Yeah,
craving for the
yes,
sweets.
yes, yes.
Yeah, great, great, sir. So, another major thing, like, should diabetics completely avoid the carbohydrates, or should they learn to manage how to have them?
Now let us understand that there are so many myths going across about carbohydrates. First of all, let us understand what is carbohydrate. It is carbon with hydrogen. And we have to understand carbohydrate is the only source, glucose is the only source of fuel for your brain. So we have to understand this. And it is one of the vital sources of energy or vital sources of fuel in our body. But unfortunately, when the word glucose is entering with this carbohydrate, many people feel that higher increase of carbohydrate will lead to higher spike of sugars, and then the incidence of diabetes happens. This is not as simple equation A follows B, B follows C that happens in our body. There is interplay of lot of hormones like insulin, cortisol, and inulin, and many other hormones.
Hmm.
I always say, as I have said earlier, and I am repeating myself, too much of anything is too bad. Limit your carbohydrates, and always diet is a balanced thing. Let us balance, and that is how nature has placed us in a harmony.
Mm-mm. So now we have spoken about the hyperglycemia kind of thing, but when it comes to hypoglycemia, there are patients, especially who are under insulin, who goes to this hypoglycemic levels, low sugar levels, with some symptoms like numbness in their hands or giddiness. So at that time, what is the first measure they can take, sir?
First simple measure in the short term is to take some sugary water or a chocolate, whatever is available to them. And but the long term measure is to correct their insulin dose, because
Okay.
insulin, it has an effect of bringing sugar down. Any drug which has an effect will also have a side effect. So
Mm.
if it is bringing sugars down, then sometimes it can cause hypoglycemia also. So you need to go to your doctor, get your insulin titration done, so that this hypoglycemia is not encountered. And let me also tell all our viewers that hypoglycemia is far more dangerous than hyperglycemia.
True, 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 sir. So when it comes to hydration part, how it affects on the diabetes levels, sugar levels, where if the people is so dehydrated? Because I could see clients who have a high HbA1c when they are too much dehydrated, and a simple lifestyle change like adjusting the water levels like 3 liters per day has a beautiful change over their HbA1c. So I wish to know like how much hydration plays a part in this diabetes.
Now, hydration plays a lot of part in all our organs. As we all know, more than 70% of our body is nothing but water.
Hmm.
If there is no adequate hydration, how can we expect all our cell organelles like mitochondria, cytoplasm, all of them to function? So rather than going to the genetic level, I would only say that if we correct the things macroscopically, automatically all internal organs at the microscopically will get corrected. And we have to also understand that we live in tropical climate, especially in India and the southern part. So we are bound to have dehydration. In spite of this dehydration, if we are not getting hydrating properly, obviously it alters all our metabolism.
Mm,
And with the newer drugs like SGLT2 inhibitors, which again are putting us at the risk of dehydration, I
mm,
believe hydration is the key.
true,
Rather than going for all these fancy diets, fat diets, I believe that correcting your water level, your sugar level, protein level, that is more important.
True, true, sir. So, also when it comes to hydration, people end up with having some juices to quench their thirst rather than of plain water. And I would say, like plain water, even if they need some flavor, like infused waters will also play a good role while hydrating themselves rather than opting for this carbonated juices or any fruit juices to avoid the sugar spike.
Yes. Carbonated water is a big no, not only for diabetes, for everybody,
True.
because these are empty calories which will
Uh,
hang on your stomach.
exactly. Great, great. So thanks for adding. Um, so as we discussed, portion and pairing of the foods matters more than the elimination of the major carbohydrate or other sources. So let's now talk about like the medical management of diabetes. So because many people once they are diagnosed with diabetes, they fear about the medications part, whether it will be a lifelong or other stuff. So when someone is starting the medication or wondering whether is it lifelong, what would you tell to them?
So let us understand at what level the HbA1c is there. Is he a newly diagnosed type 1 diabetic or type 2 diabetic? Type 1 diabetic, unfortunately, we have not found any solution till now. So he has because the disease itself is a deficiency of insulin, we have to give him insulin, irrespective of what happens. Now, in type 2 diabetes, as I have told, the first thing is to change your diet. Second, your increase your physical activity. Third is to correct your sleep and stress, and then only medications will come and matter. These are
Mm,
the four pillars of our diabetes management.
okay.
So will diabetes medications will be continued for lifelong? It totally depends on your three earlier pillars. If you have taken care of your diet, your physical activity, and sleep and stress, then automatically there is very less value of this medications.
Mm,
And we have seen a lot of cases in early type 2 diabetes who were overweight and obese. Once they reduce their weight, automatically we can take off their medications. And
okay.
if they continue their weight for lifelong, I hope these medications will also be not needed in their life.
So when is the point you will take a call to start with the medications or insulin dosages?
Ideally, we will start them when their HbA1c level is not controlled even after 3 months of
Mm,
rigorous lifestyle management, then we will go for the medication.
okay.
I believe drug is the last choice, not the first choice.
So people have to set their lifestyle first, and then once again repeat their HbA1c levels before getting into any medications.
Yes.
Great, great, sir. So, I also wish to know about the continuous glucose monitors, CGM, which is now trending in monitoring the diabetes level. So, to whom can we suggest this CGM, and is it even useful for non-insulin diabetes people also?
CGM stands for continuous glucose monitoring. Anybody who wants his glucose to be monitored continually can take it. As a
Mm,
matter of fact, even I have one CGM with myself right now. I want to monitor my sugars. How are they happening in Ramadan? So, first thing we have to understand in medicine is if you cannot track anything, how can you treat it?
mm, true.
But CGMS was originally invented for type 1 diabetes, in which fluctuations for sugars were very high.
Mm,
But now we are giving CGMS for type 2 diabetes patients who are not under control because we want to find out at which meal the sugars are high, spiking and with which food the sugars are spiking. And
mm,
then the role of CGMS in GDM is also very high. Instead
mm,
of asking a pregnant lady to prick herself for 6 times in a day, it is better to give them a small patch and
mm,
it will continuously monitor your sugars.
mm,
And I advise anybody who wants to have their health monitor have CGMS once in a year, not through the entire life,
mm.
so that you will understand. With, for example, with rice your sugar is spiking, with wheat your sugar is spiking. We can easily monitor with it.
True.
And as I have just told you, if you cannot track anything, then you cannot treat it.
Yeah. So similarly, when we go for CGM, I think they should also maintain a food journal along with the CGM so that whenever the sugar spikes happening, they have to make a note of what is the food they had. So it will be easy for us to correlate it and guide them in a better manner. Is it so, sir?
Yeah, as a matter of fact, all Abbott Libre CGMS which are coming. In the app, they have already all these things inbuilt.
Okay.
So whenever you eat, you just have to make a note in the app and it will
Oh.
record it,
Oh, nice, nice. Yeah. So only then we can have a note like how the drugs
correlate.
is working. Yeah. Great, sir. So when as you said, when it comes to GDM, gestational diabetes mellitus. So when it comes to GDM, is there any possibility for them to get into diabetes in their near future, or is there any possibility of their children to become a diabetic in future?
Of course, more than 20%, unfortunately, of these GDM patients will land into diabetes according to the studies which are published. Now, let us understand pregnancy is a condition in which it will bring all the internal diseases outside of your body. For example, if somebody has high blood pressure in pregnancy, then she is bound to have high blood pressure later in part of her life. If somebody has high sugars in her pregnancy, then she is bound to have high sugars in later part of her life.
So, but if they are maintaining a proper lifestyle after the delivery, because post delivery, most of the mothers are getting their sugar levels down. So, it was only during the delivery, people are into this GDM. Even I myself was diagnosed with GDM when I was delivering my both of my kids. But after the delivery, it took like around for me like 6 months to get back to the normal values. I was keeping the HbA1c on check, and it came back to the normal value. So after that I started making the lifestyle changes, so on a strict basis, so that as of now I'm not diagnosed with any of such yet. But still, is it mandatory for me or any of the mothers like me to check their diabetes every year once, to just have a track?
Not only you, but everybody who is above the age of 30 have to get their master health checkup done once in a year. Not
Mm.
only HbA1c, but all your critical
Critical
parameters.
parameters.
This
Okay.
has been mandatory in many Gulf countries and also in Japan,
Mm.
because of which they are able to manage.
Mm.
Now, when we see a new cath lab or a new dialysis opening in our town, we feel very happy. But we should be actually very sad that these things are useful only when end organ damage has already been done. When some cardiac issue has happened, when nephropathy has come, then only the role of these dialysis centers come. So,
Mm.
as a matter of fact, all of us should focus, as we have been taught, that prevention is better than cure.
So, for the present trend, everyone after 30 plus are supposed to do a master health checkup to get check
Once
of
in a
their
year,
once in a year, to get check of their clinical parameters. True, true. So, when it comes to diabetic drugs, there are new drugs coming up in the trends, like GLP-1 medications. And as you said, hydration also plays a vital role in this. So, what are the other benefits and concern about these new medications?
so these drugs have been studied for the past 5 to 6 years extensively. And diabetes earlier was only thought about sugars. But according to recent NICE guidelines, ADA guidelines, or even our RSSGI guidelines, we have come to a fact that diabetes is not only about sugars. We have to treat simultaneously for the cardiac, for the renal, and for all the metabolic factors. So
Mm.
these GLP-1 analogs have shown tremendous risk benefit in the terms of lowering risk for your cardiac, renal, and metabolic parameters.
Got
That
it.
is why they have become the blockbuster molecules, because they are acting at the central point levels of GLP-1. It is glucagon-like peptide. So it is decreasing your satiety. So once your satiety is decreased, your weight will be decreased. Once your weight is decreased, all the obesity, as we all know, is the mother of all diseases. So all of these things will be taken care of. Not
Mm-mm.
only weight individually, all these cardiac, renal, and metabolic parameters, they have shown tremendous benefit with these GLP-1
GLP-1
analogs.
medications. Great, great, great. So, is there any values or like HbA1c values after which the person can take the GLP-1 medications? Like, to whom is it prescribed?
GLP-1 analogs, according to the recent guidelines, have been started if somebody HbA1c around more than 6.5, in many parts is considered as diabetes. So
Okay.
we will start if is basic with metformin, and if he is overweight, then we will straight away go on for GLP-1 analogs.
Okay, so obesity matters a lot when it comes to
Yes,
GLP-1.
based
Fine.
on BMI, we are going to GLP-1 analogs.
Great, great, sir. So beyond food, lifestyle plays a vital role. Since you are an expert in that field too, I would like to ask, like, how do stress and sleep strongly impact on the blood sugar levels?
Now, in this age of urbanization and rapidization, our sleep is decreasing less and less. Our mobile phones sleep only when we sleep because we sleep only when our mobiles are asleep. So, because of these disturbances in the circadian rhythm,
Hmm.
cortisol plays a very big role in hyperglycemia. When this cortisol is not taken care of, it automatically spikes our sugars.
Hmm.
And most importantly, we have to understand lack of sleep, increase of stress adds to insulin resistance,
Hmm.
which needs to be treated more than anything else. We always run behind the number of fasting, post strength, and HbA1c rather looking at the root cause,
Hmm.
which you all of you are doing at the holistic nutrition program.
True, true, sir. Yes, so when we address the simple parameters like hydration, diet, along with sleep and lifestyle, it shows a drastic impact on over the clients. So when it comes to stress, how do you handle such patients? And what do you tell to the common people who are too stressed out? And what is the call they should take when they are stressed out?
So, first of all, let us understand what stress is. Stress can be totally different for you in your home and totally different for me in my hospital. So, whatever is happening, if it is not going according to the wish and whims of the person, he will call it as stress. Now we are seeing even children of 3 to 5 years who are feeling stressful because they cannot watch the cartoon.
Uh,
So I tell them that let us understand what is stopping from having what you want to pursue or what is there. I because this is needs specialized counseling and there are psychological people who take care of this. But on the whole, I would like to say let us understand because these days there are very silly reasons for which we are getting stressful just because somebody loses a match and somebody's girlfriend or boyfriend are not texting them back. These are simple reasons which are adding PCOS, overweight, lot of which are seen in our teenager girls. So let us understand what stress is and then we can deal with it. If you cannot deal with it yourself, kindly take a help of counselor and there is no shame or stigma in dealing with stress. Because
exactly.
once you treat the root cause, then definitely it will manifest in your wellness as well.
True, sir. So reaching out to the counselor matters a lot because most of the people they say that they are stressed out, but they never take a step to uh, come over it. They don't speak out of their stresses. More than the stress, keeping it within themselves actually hurts a lot, I would say. So it is always
Yes.
better to speak out what they are feeling to some of the closest person nearby so that they can get proper help and they can come out of it. True, true. So when
Even a
it
simple journaling will help you
exactly,
free of all your stress.
yeah.
Because
So
once you put your words in your letters, then you will understand there is nothing. It is because all the stress is made in your mind. It is not physically present anywhere in your body.
so once they put out, they will be aware like what is the stress going on. Sometimes people are not aware like what is going on inside their mind itself. So as you said, when they at least put it in a pen and paper and do some deep breathing, they might get a better clarity, and it might be not that much stressful even to think about. Yeah. So when it comes to gut health, how does the gut health influence the diabetes? Because most of the people ignore gut health, and it could be like a starting stage of their diabetes. So how much aware we should be with respect to the gut health?
So Hippocrates said, "Eat your food like medicine, and your medicine like your food." We are all aware of the gut-brain axis and its impact in all the diseases, not only in diabetes, but all metabolic disorders and even in autoimmune disorders. We have to understand that when gut is inflamed, metabolism suffers. And when metabolism suffers, everything suffers. So the proper thing is to be aware of what you are eating. I see a lot of our children eating, binge eating, watching TVs or watching smartphones. This leads to alteration of gut microbiome, which then
Mm,
sends signals to our brain that even though the child has enough food, still it will not send the signal of satiety to the brain. When this happens, the child will overeat. Because of the overeating, definitely calories are more than required. And this leads to diabetes, hypertension, obesity, and everything.
So they have to be aware like what is going on inside their gut when it comes to gut health, whether they are feeling acidity or bloating. Also, they have to get a check over that at the same time rather than ignoring it. True. So
Yes,
we have discussed about the stress, sleep, hydration, diet. So the last but not least part is like the physical activity. So, what is the physical activity that one must do when they are diagnosed with diabetes? And
I always say that if you marry increased calories with decreased physical activity, then you will have a child called obesity, which will give you diabetes, hypertension, and multiple metabolic disorders. Physical activity is one of the cornerstone for all of us. Unfortunately, sedentary lifestyle has induced us in a state of pandemic of diabetes. Now, when we speak about physical activity, there are basically two things: simple walking and then strengthening.
strength.
Now, it depends on the prescription of exercise or physical activity that you want to give. I cannot give strengthening or running to a 50-year-old female with osteoarthritis. In these cases, it is advisable to do whatever physical activity she can do.
Mm,
But I always say that simple walking after your all your meals will increase the glucose uptake. As we all know, muscle is the medicine now, and muscle is the only organ after liver which helps us in the glucose intake. And this physical activity is very much important for treatment of diabetes more than medications, I believe.
true. True, yeah, they have to burn those excess calories, which is converted into fat. So, in that case, they have to start with some physical activity. As you said, when it comes to people like around 50 plus, if they are not unable to go and do the strength training, at least I think they can do some strengthening with dumbbells. One can use
Bands,
dumbbells or bottles to be more
yes,
easy. So at least their upper part hands are getting some sort of strengthening. And also 30 plus, if people are 30 plus, I hope they should start with their strength training at that phase itself rather than waiting till 50 and diagnosing with some other ailments. I hope they can start working on their physical part when they are in early 20s and 30s to avoid this future complications.
yes. Recent guidelines have told us that all adults who are above the age of 30 should exercise at least for 150 minutes
True, true.
per week
uh,
in the 5 sessions of 30 minutes each, which is combination of high intensive exercises, aerobic exercises and anaerobic exercise. Even if it is not possible, I always tell all our patients to avoid lifts, take stairs, try to park your car as far as possible because going to gym is difficult, but walking around in your home and making these small things is very easy because I have been noting even for going to the nearby street, we use our bikes rather
yeah.
than walking.
Yes, yes.
These small tidbits can help us, and I believe natural is the only way we can move forward
Yeah, even
rather than subscribing to the high-end gyms.
yeah, so even like going for some hours of badminton or any other games rather than gym, sticking on to gyms will also work. It simultaneously gives them the relaxation too.
Even if they do their household chores by helping their
True.
maid for 1 to 2 hours, that is more than enough.
Yeah, that's an excellent workout, I would say. Great, great, sir. So we were like talking about obesity and diabetes, but we also see lean people having still getting diabetes. So what would you tell about that, sir? Why do they?
So basically, this lean type of uh, diabetes is found in Asian phenotype, mostly Indian phenotype. This is what we call fat inside but thin outside. In these people, lot of visceral adiposity is deposited. And though they look lean and their BMI is less, but still they are having lot of these factors which cause obesity and which are detrimental, causing diabetes, hypertension, and even MASH, fatty liver, what we used to call earlier, are high incidence in these people.
So rather we can say, like, instead of just looking over the sugar levels, it is more like a metabolic ecosystem which we need to look over when it comes to lean type of
Yes,
diabetes. Yeah. So
yes,
this is where I think the medical care and lifestyle care actually complement each other beautifully, and it goes hand in hand. So now we
yes,
come perhaps to the interesting and important part of the today's discussion, the cultural aspect. So since this is
yeah,
the month of Ramadan, I would like to ask few questions about fasting during Ramadan. So, doctor, I have
sure.
seen clients struggling between faith and fear. Like during Ramadan, they feel more anxious medically, but still motivated spiritually. So, to them, from a medical point of view, what guidance would you offer? Can people with diabetes safely fast in Ramadan? And how do you assess whether the patient is physically fit to fast with diabetes?
Oh, yeah. So let us understand that fasting is ibadah, but health is amana. So we have formulated something called IDF Diabetes, International Diabetes Federation Diabetes Alliance for Ramadan guidelines. And these guidelines, mind you, were formulated with medical doctors along with the religious scholars of all major countries. So, based on these IDF DAR guidelines, if we discuss, we have to first risk stratify the patient. There are four categories in which we can classify them. First is very high risk person, somebody who is type 1 diabetes with poorly controlled diabetes or who has severe hypos, or somebody who is in CKD stage 3 or somebody who is pregnant. And then there is high risk category, which is type 2 diabetes but poorly controlled. And then there is moderate risk patients with in which we see hypos, and finally the very low risk category of patients in which sugars are controlled. Based on this stratification, we classify them. And in fact, we tell all our patients to get their blood glucose checked 3 to 4 weeks before the advent of Ramadan so that we can stratify them properly.
Great, great. I also came to know that in IDF there is a form like how to say, like a assessment form where people can enter their data and figure out whether they can fast during the Ramadan or not.
Sure. At the end of the, I will share you the link. It is a simple calculator in which
Mm.
you enter your values and
Mm.
you will get a score. And based on the score, you can ideally prove yourself.
Great, great, great. Then that would help. But when it comes to type 1 diabetes, it is not recommended for them to fast, right, sir? Yeah, can you hear me? Yeah. So when it comes to type 1 diabetes, I hope they are not recommended to do a fast during Ramadan. How about that, sir?
Ideally speaking, they cannot because of the fluctuations of the glucose. But in some parts of the country where somebody who is already on CGM and their sugars are very well controlled, then they can fast. Because
Oh.
let us understand, fasting is a very emotional decision for all the people around the world, especially is Muslims. So we cannot deprive somebody of his or her cultural and religious right based on our scientific ability. And it has been found out that you can easily and you should track your sugars even when you are fasting.
Mm.
There is no problem if somebody pricks herself and monitors her sugar.
Mm,
And
mm,
once if
mm.
sugars are low, then obviously she has to break the fast. If sugars
True.
are under control, she can continue it.
Yeah, even as you said, if there is any warning signs during fastings, then one must break the fast immediately. So you also mentioned that they can prick their blood for the blood sugar monitoring levels. So is it okay to prick the blood? Because people feel that pricking while the blood is coming out, then the fast might get terminated. Kind of thoughts. So how would you address them?
So, first of all, we have to understand this concept of fasting in Islam. Fasting was brought for the betterment of health and spirituality of human beings. Now, for this betterment, there are some things which needs to avoided. Earlier, it was said only if there is high amount of blood which can cause detriment to your health, like in which increased bleeding can cause you giddiness or fall in your blood pressure. Only then it breaks your fast.
Hmm.
So, but unfortunately, this has been translated to any drop of blood that comes out of your body as breaking the fast.
True, true, true. Thanks for getting a clarity over that, sir. So, common Ramadan mistakes that diabetics make that spikes their sugar levels. What do you think about that?
Unfortunately, we are told that we are fasting, but it is the other way around. We feast more than we fast.
True. If that piece is too celebrated rather than being mindful about the portion control.
Yes, and let me tell you, you as a dietitian, if you check weights of all the peoples who are feasting after fasting, their weights will be increased more in Ramadan than the other months of their fasting. And not having a proper Ramadan consultation assessment earlier, having high oily food, spicy food, increased carbohydrate food immediately after your iftar. It is
Hmm.
like you are cleaning your machinery of your digestive system, and suddenly you dump so much of oil and grease in it that it will stop functioning.
True, true, true.
Especially all these sugary drinks,
Hmm.
deep fried snacks, which all are our favorites, but it needs to be avoided.
So, which is the best way to break the fast, sir?
As prescribed by the Prophet himself, dates, milk, water, and fruits.
Good, good. So I think the dates with cucumber, which is a sunnah food, I hope
Yes,
that will never spike the insulin level for even in a diabetes. Adding the
yes,
fiber along with the dates is like a good source which Prophet Sallallahu Alaihi Wasallam has advised us. So when it comes to the Ramadan medication and timings, so is there any
yes,
changes that they have to make? And I think, as you said, they have to come for a checkup before Ramadan, like a pre-Ramadan diabetes checkup has to be done. And
yes.
I hope there should be some changes on the medications part which they are having. Can you just throw some light over that?
So basically, whoever comes for pre-Ramadan diet, Ramadan assessment to us, what we do is if somebody is on insulin, then we down titrate his basal insulin to at least 20 to 30% levels. And then if somebody is on sulfonylureas like glimepiride, then we try to push them at the time of iftar and cut their doses in the sahar. Because as we all know, once you start fasting, these days we are fasting for around 12 hours. To
Mm,
avoid the risk of hypoglycemia, we titrate these drugs. But
mm,
these should be done 4 weeks before the Ramadan,
mm.
ideally. But if somebody is not getting them done, even now is the right time to get them.
Yeah, so they have to get in check with the diabetes medications before fasting because it is like a swapping time for us because on usual days we will be having the minimal dose at the night time because we will be fasting overnight. But during Ramadan, it
Yes,
happens the other way around. So we should have the minimal dose over the suhoor period rather than in the iftar, I think. So
yes.
those medications has to be checked. So anyone who's watching this video, if you are with diabetes and fasting during this Ramadan, please get consulted over the diabetes and get checked with your medication values and adjust it. So that is really a great takeaway of this session, sir. So like I think this guidance can really reduce the anxiety for many families during this Ramadan. So before we close the session, I want to do a quick rapid fire round with you with respect to the diabetes. Can we just start with the rapid fire, sir?
Sure, sure.
Yeah. So, what is the one diabetes myth you want to erase forever?
Something called diabetes diet. It doesn't exist. You have to manage whatever you're eating on your own.
Great, great. So, one habit every diabetic must start today. What is the one habit?
Phys- Simple physical activity, doing your own household chores.
So, yeah, sir is mentioning is this second time. So, doctor, as doctor said, start doing your household chores, which is the best kind of workout you can do. So, one habit like every diabetic must stop today.
Skipping sleep.
Ah.
Try to sleep on time.
Try to sleep on time, especially at least the 7 to 8 hours of sleep is far better for getting your diabetes on track. Great, sir.
We
So,
are always running behind these shining orbit syndromes. What is the best drug? What is the novel molecule? What is the new fad diet? What is the new supplement? Rather than correcting ourselves internally. Okay, what is going wrong inside my body that I can correct now?
yeah, so people are looking more of a quick fix kind of thing rather than a sustainability. So when the practice becomes sustainable, they can get sustainable results rather than these quick fixes. Yeah, true, true, sir. So, what is the one underrated food for diabetics?
Fruits,
Food, fruits.
antioxidants, fibers, which unfortunately all of the diabetes people are prevented from having.
True, true, sir. Because there's a many myths running around food when it comes to diabetes, and fruit is one of them. So whenever they diagnose with diabetes, the first question the client will ask to us is whether we can eat fruits or not, whether we can have banana or not. So it is all about the quantity and the proportion and the frequency you are having it. Great, sir. So what is the one overhyped diabetic food?
These diabetic fat diets.
Fat diets over diabetes. Yeah, great, great, sir. So, when it better for sugar control, is it walking or strength training?
Both.
Both.
But if you are an elderly, if you cannot do strength, at least do the walking.
Do the
If you
walking.
cannot do walking, at least do whatever physical activity you can do.
Maybe to
But do
start,
something.
yeah, maybe to start with, they can at least do some sort of deep breathing, which
Deep breathing, just simple standing, sitting, even that is enough for them.
yeah, yeah, true, true, sir. So, when it comes to sleep or diet, which is most ignored in the patients?
Sleep is more ignored. There is a dietitian, but there are very less sleep medication available or sleep specialists available around us.
True, true, sir. Okay, so what is one Ramadan tip for a stable sugar levels, maintaining a stable sugar levels?
Never skip glucose monitoring because if you cannot track anything, then you cannot read anything.
So this is the one point which doctor is repeating once again. So always keep a track on your blood sugar levels to track your status. So coming to one sign, fasting should be stopped immediately when it comes to the diabetic patients.
So when you say sign, then it is sugar below 70. But if you say symptom, any giddiness or any loss of consciousness or anything, and you
Mm,
get your sugar checked, and if it's less than 70, and if it's more than 300, then also you have to stop fasting
okay,
according
so
to IDF DAR guidelines.
okay, okay. So if it is also above 300, then they have to get over their medications and stop the fasting at that
Yes,
period time. Okay, great.
yes.
So what is the one final message to someone newly diagnosed with diabetes you wish to say?
Diabetes is manageable, denial is dangerous. Diabetes is manageable, denial is dangerous. As I always say, let us treat diabetes as our dost and not an enemy. Once you get in friendship with it, then you will talk with him or her, you track her, and then you treat her, then everything will be fine. Let us not make enemy of our own body.
Great, great. So overall, we have to understand what our body tells. So
Yes.
once we start understand our body's natural cues and start noticing it and give importance and correct it on a regular basis, I hope it won't lead to any terminal illness. Great, great,
and
doctor.
treat our body holistically.
Yeah, true. So, yes, doctor. So, I want to thank you for such practical and many reassuring insights that helps many of us and who are watching this series. And I'm sure this conversation will help many people navigate the diabetes with more clarity and confidence. And to all our viewers, awareness is the first step towards better health, and small informed steps leads to a lasting change. With that note, I will just close this series. We look forward to see you all in our next episode of Let's Talk Health Beyond Prescription. Thank you, doctor.
Thank you. Thank you so much.